common sternal precautions. A patient might have sternal precautions because the surgeon cuts through the sternum to access underneath the rib cage. So then the sternum is put back together with wires, and any motion where the arm is held out to the side can pull on the sternum. So what we need to avoid is reaching our arm up overhead, reaching our arm out to the side, and reaching behind us. In addition, our patient should not lift anything heavier than 5 to 10 pounds. Sternal precautions are specific to the surgeon, so always defer to what precautions were ordered by the doctor. Lastly, for a patient who has sternal precautions, if they're coughing or if they're doing their intensive spirometer, you would want them to hug a pillow across their chest for bracing, because that can provide a lot of comfort and allow them to do their deep breathing more effectively. Now we're going to talk about coming to the side of the bed with sternal precautions, which can be challenging because it's hard not to use your arms, and we do want to minimize the use of our arms when we're moving our patient to the side of the bed. So our patient should log roll onto their side first, then she'll move her feet forward off the front of the bed, and then she can push with her top arm off of the bed rail or the bed. She's crossing her body. We don't want her to use that arm that's down to push out and up. Now we'll talk about our sternal precautions of no reaching overhead, out to the side, or behind you. We also want to avoid reaching too far forward. These come into play often when a patient is getting dressed. So we wouldn't want her reaching overhead, putting on her shirt, or doing other self-care tasks. We also wouldn't want our patient reaching too far out to the side if they're trying to get their belongings. When we set up the patient tray, everything should be close within reach, not to have the tray extended where she would have to be reaching really far out in front of her. We also want to avoid our patients reaching behind them, whether they're fidgeting or fixing their clothing, or using their arms on the surface to try to reposition themselves. All of those would be examples of breaking their sternal precautions. Now we'll talk about the idea of splinting with a pillow. So this is important after a patient might have sternal precautions, because it can help reduce pain and it can help facilitate deeper breathing, which is very important after surgery. So you can fold the pillow, have them squeeze it across their chest. This would be really helpful for them to do if they're having any coughing fits, and especially to do when they're doing their intensive spirometer. It can be really tempting for our patients to want to push up with their arms or pull up from the walker when they're trying to stand. But when someone has sternal precautions, they can't have their arms out to the side to push up, and we never want our patients pulling up from the walker. So what we would advise is that the patient keep their hands in their lap, and they can use that to get a little bit of support as they stand. Now let's review our sternal precautions. Remember, sternal precautions are specific to the surgeon, so always defer to what they've ordered for the patient. The sternal precautions are no reaching overhead, no reaching out to the side, and no reaching behind you. Additionally, these patients should not carry anything heavier than 5 to 10 pounds, about a gallon of milk, and we want them to use a pillow over their chest for splinting whenever they're coughing or using their intensive spirometer. If you have any questions after watching this video, please reach out to a therapist, or when you have a patient with sternal precautions, feel free to reach out to a therapist if you have more questions. Thank you for watching our video.